Um, Hello, everybody, and welcome to today's webinar on LGBT plus rights and gender responsive social protection and why the connection matters. My name is Louisa Lippi. I'm an independent consultant and senior technical advisor within the STAAR facilities technical senior leadership team, and I'm going to be your moderator for today's session. In today's webinar, we will be discussing how social protection systems can better serve LGBT plus individuals. The presenters will provide an overview of the current state of evidence on social protection for LGBT plus persons, looking at the gaps and understanding what works, what doesn't, and what remains missing to build inclusive systems to support people with diverse sexual orientation, gender identities, gender expressions, and sexual characteristics. At the bottom of this screen, you can click the plus sign for more information about the webinar and including the resources that the presenters will talk about today, and additional resources about the topic. This is the fourth webinar on a gender responsive and inclusive social protection series, which are being organized and facilitated by the STAAR facility. The other three webinars are available on sp.org. Again, you can click the plus sign at the bottom to access those. So we do encourage you to have a listen. It's a very good series on what's working within the GRSP space. Before I introduce our panelists, I'd like to quickly go over some house rules. So first and foremost, the session is being recorded, and along with the presentations, they will be made available on socialprotection.org and also emailed to all registrants of the session. Please use the chat box to introduce yourself and make comments and share useful links, but we do ask if you want to have questions to the discussants and the presenters that you use the Q&A box. We will be monitoring that box for questions during the session at the end rather than the chat box, so please use that. And we also encourage you to use the chat box and ask questions while the presenters are speaking. And then at the end in our discussion session, we'll go back and pull those questions up. But while they're fresh in your mind, we do ask you to, use the chat box or the Q&A box, sorry. We also would ask you to be specific as possible in your questions. So when we do go back at the end, we understand who you are asking the question to. So you could put in the chat box who you want to answer your question and contextualize it as much as possible, because we aren't able to go back to you for clarifications during the Q&A session. In terms of the agenda for today, we will have opening remarks. So we're doing the housekeeping, and then we'll have opening remarks from Jenny Carlen, the Gender and Crisis Advisor from FCDO, to open the session. We will do a presentation of the main report, and then followed by discussants on their reactions to the report and what's going on in the space for LGBT plus people and social protection at large. And then we'll end with 20 minutes of Q&A. I'm very happy to be joined by our three fabulous presenters, so Cody Freeman, Loui Williams, and Emily Dwyer. And I'll just do a quick introduction of the panel. So Cody Freeman, using all pronouns, is a researcher, educator, and activist focusing on queer youth. They are the founder and CEO of the Global Center, an NGO dedicated to LGBT plus youth and education globally. Cody has researched and written extensively on queer education and LGBT plus rights for the World Bank, Save the Children, FRI, and for FCDO. For FCDO, Cody and his co-author Maria Clara Klaus undertook a mapping of the existing evidence on LGBT plus inclusive social protection, and he'll be talking about this today. Louis Williams, using she and they, is a research analyst with UN Women's Research and Data Section. Most recently, Loui has worked on the Secretary General's report, Harnessing Social Protection for Gender Equality, Resilience, and Transformation, which addresses the importance of gender-responsive social protection. As the UN Globe Coordinator for UN Women, Loui also advocates for equality and non-discrimination for LGBT plus personnel within the UN system. And Emily Dwyer is the CEO of EdgeEffect, an LGBTQIA plus humanitarian and development organization. Emily's earlier work focused on international journalism, media development, and humanitarian information projects. After affirming herself as a trans woman, Emily co-founded the EdgeEffect, a humanitarian and development organization focusing on inclusive practices for persons with diverse sexual orientations, gender identities, and expressions. She has led the development of a number of projects focusing on greater inclusion of LGBT plus QIA persons, including a review of social protection systems and the design of a national program to increase LGBT plus QIA inclusion in social protection in Indonesia. And she will speak about these things in her remarks later today. I'd like to pass over to Jenny Carlen, Gender and Crisis Advisor at FCDO, to provide some opening remarks to frame the session. Over to you, Jenny.
Thank you so much, Louisa, and good morning, good afternoon, good evening to everyone joining. Thank you so much for giving me the opportunity to provide the opening remarks today. And I think this is a really exciting webinar exploring the connections between LGBT plus rights and inclusive social protection. As Louisa has said, I'm the lead advisor for gender and inclusion working in the FCDO social protection team. Acronym there is the UK's Foreign, Commonwealth and Development Office. And I see a really key aim of this webinar is trying to kind of break down silos and getting to sectors that potentially don't often talk to each other very much to join up and understand each other a bit more, those working in the LGBT rights space and those working on social protection. So in that spirit, I'll start with a super quick introduction in terms of what I'm talking about when I'm talking about social protection. And so social protection is a set of policies and programs designed to reduce poverty and help people cope with risks and shocks, such as unemployment, illness, disability, and old age. So this includes things like cash transfers, pensions, child benefits, health insurance, maternity benefits, and support for people with disabilities, amongst other things. So much evidence now shows us that social protection can provide a really vital mechanism for lifting the most vulnerable people out of poverty. But we are also learning that these positive outcomes are neither guaranteed or automatic. We need to be really intentional in the design and implementation of social protection systems if we want to secure these gains. As a sector, we've been thinking more and more intentionally about how we meet the needs of women and girls, but the specific challenges and opportunities faced by the LGBT plus populations have, in my opinion, for too long been neglected. And this is a real shortcoming because the evidence shows us that these populations face compounded vulnerabilities, economic insecurity, health disparities, violence and housing instability, for example, and that's often exacerbated by discriminatory laws and norms. We see social protection as a human right that should be used to support the well-being for all, and yet we know that for too many LGBT plus individuals, it remains out of reach, and they are still relying on informal networks, community groups, NGOs, which often provide the only lifeline, especially in hostile environments where state systems fail or even actively contribute to the harm that these individuals face. These gaps underscore why truly inclusive social protection is not just desirable, it's essential. It's key to ensuring that the minimum we're doing no harm, and it's key to making sure that these systems are actually securing the outcomes that we really care about. So I was really proud to be involved in commissioning the report that we're going to hear more about today, which, alongside highlighting some of the challenges, also sets out some really promising pathways for better join up, for improving systems and policies. So I'm really excited to be part of this discussion, hearing from the panelists, and also I'd really encourage all participants to think about your own questions, reflections, experiences, and bring them to the discussion today so we can have a really good dialogue. Thank you.
Thanks, Jenny. Thanks so much for those opening remarks and for setting the scene for the presentations and the discussion. I will now pass over to Cody Freeman, co-author of the paper that maps social protection of LGBT plus persons. So over to you, Cody.
Great. Thank you very much, Louisa and Jenny, for your words. It's wonderful to see you all here today. Over the next few minutes, I'll provide a brief summary of the evidence mapping conducted by Dr. Maria Clara Kus and myself earlier this year. This research was funded by the UK Foreign Commonwealth and Development Office, FCDO. It was supported by STAAR and implemented by DAI. So this work aimed to map the state of evidence on social protection for LGBT plus persons, and it focused on three primary questions. First, of what social protection programs exist that support LGBT plus persons? What are the pathways for supporting LGBT plus populations through social protection? And what implementation factors influence social protection's ability to effectively and safely address LGBT plus vulnerabilities? This research and the webinar today comes at a really critical time of rising anti-gender movements, austerity measures, shrinking civic space, and increased hostility towards LGBT plus communities. So with that in mind, we took a really holistic approach to capture a broad range of interventions being done. Because to many, social protection is equal to cash transfers, right? But we're, as shown in the figure here, we aim to expand this thinking about what social protection could be to also include, yes, the non-contributory social protection, such as cash transfers and subsidies, but also contributory programs such as unemployment and social insurance, systems linkages to labor markets and housing, education, as well as the informal social protection that Jenny was mentioning, through peers and civil society organizations. This last one, informal social protection, is especially important in hostile environments where the state is actively contributing to violence against LGBT people. We're also thinking of gender responsive social protection beyond the binary, so to also include LGBT plus persons. While it's traditionally focused on the needs and vulnerabilities of women and girls, gender inequalities also directly affect LGBT plus persons. Because when individuals deviate from traditional gender norms and expressions, they often face social exclusion and marginalization. This then leads to negative socioeconomic outcomes and impacts. So there's a need for a more expansive definition of gender responsive social protection because of those factors. And to further understand why even LGBT inclusive social protection matters, we need to ground it in the realities that LGBT people face. Although experiences vary by context, geography, intersectional identities, the global pattern from the evidence that we have is quite clear. LGBT people face structural barriers and disproportionate adverse socioeconomic impacts. These challenges, as shown on the screen, cut across every sector of life. And further, LGBT plus persons face higher levels of poverty compared to straight and cisgender counterparts. So we're saying that this is where social protection comes in. Social protection can help to reduce poverty and relieve some of the heightened vulnerabilities that LGBT people face. So let's look at how this study contributes and furthers that understanding. So our report followed a scoping review methodology. We gathered literature using three different strategies. The first being electronic database searching using Google and Google Scholar with predefined search terms, reviewing reference list of highly cited studies, and outreach to experts through email. And we also organized a key stakeholder workshop. And together, these searches yielded 51 different documents that met our criteria. So to bring that into our three questions, the first one is what social programs exist, right? So overall, most government-led programs didn't explicitly include LGBT people. And we learned from this literature review process that when SOGIESC isn't named explicitly, programs often miss the mark about really understanding the realities that LGBT people face. Non-contributory programs were referenced most frequently, but contributory programs also appeared. Some studies did link social protection to broader systems, and informal social protection played a major role as well, highlighted in over half the studies. But I want to highlight the intersectionality matters about underneath the LGBTI plus umbrella. Age and migration were often considered in the literature. However, some identities remain underexplored, including intersex persons, asexual, non-binary, LGBT persons with disabilities. They're rarely mentioned in this literature base, and despite facing compounding barriers. So that's an area for continued research. Our second question looked at the pathways through which social protection can support LGBT plus persons. And here we found 5 distinct pathways that emerged. First is mitigating economic vulnerability. So under this, studies highlighted how cash transfers, unemployment benefits, rent subsidies, and tax credits can ease financial pressure. Second is improving economic opportunities. The literature mentioned how social protection can expand livelihoods through asset transfers, job referrals, vocational training, and skills building. Accessing healthcare is another pathway. Several documents discussed how inclusive health insurance improved access to affordable care, and this is inclusive of gender affirming care. And in less supportive contexts, informal systems such as Trans for Trans crowdfunding helped cover medical costs, and they provided a safe community space. Fourth, accessing social care. This includes safe, affordable LGBT plus senior housing, for example, that offers protection and belonging. And fifth is protection from violence. So income support can help individuals escape violent situations, especially where housing or legal assistance is needed. And the third question of implementation, some of the problems and solutions in this. So here, discrimination was one of the largest barriers to access. Biases prevent LGBT plus people from accessing services, reporting abuse, or even being legally recognized by the state. Further, many trans and gender diverse people faced barriers when their ID didn't align with their gender identity. Databases and algorithms often exclude LGBT plus individuals by SOGIESC, omitting SOGIESC disaggregated data, or even applying eligibility rules that really don't reflect LGBT persons' lived realities. Poorly managed data also put people at risk of outing or harm. And finally, there were some challenges around the quality of social protection schemes. Studies discussed short benefit duration, irregular disbursements, and unpredictable policy shifts. So I know that's quite a lot for a global evidence mapping. So just to focus on some key takeaways as a result of this literature review process. And we have proposed here, and you can read more about it in the report, 12 different recommendations about how do we move towards LGBT inclusive social protection. And we bucketed it into 4 key focus areas. The first is about values and norms. So social protection systems must confront discriminatory values and norms embedded in the design and delivery of the program. This includes strengthening institutional capacity through trainings, for example, and supporting informal social protection, particularly less accepting environments. Second is around eligibility and enrollment. Administrative processes need redesigning so that LGBT people can access services when they are available. Practical examples include flexible enrollment systems, addressing rigid definitions of gender and family, and acting beyond the data gap. Third, information management and data security to ensure strict safety and ethical standards in SOGIESC-related data collection, as well as data management, so privacy protections, safeguarding measures. Finally, advancing LGBT inclusive social protection requires really strong collaboration between both social protection actors and LGBT plus actors. Building better systems and really mobilizing these recommendations relies on shared learning, on continued dialogue, on cross-movement actionable strategies like we're doing here today. So with that, I just want to say thank you for being a part of this discussion and for the work that you are doing to advance LGBT plus inclusive social protection.
Cody, thank you so much for that presentation and for providing that scene setting again with the mapping of what's available currently within the LGBT plus social protection space. I think it's I would really encourage everyone to read the report and have a look at it. While it is a nascent area of research, I think that that both Cody and Maria were able to find more examples than I thought were existing on good practices around this. And so I think that this has been a really remarkable piece of work and a great step forward into this area. I wanted to invite Emily maybe to share her reflections next, since EdgeEffect has really been a pioneer in this area. In 2001, they did a review of social protection systems for LGBT plus individuals in response to the COVID-19 pandemic, and then also developing targeted programs for people with LGBT plus identities in Indonesia. And so they've really taken a lot of research and translated this into practice on the ground. And so we would love to hear your reflections next. Over to you, Emily.
Thank you very much, Louisa, and thank you, Cody, and co-authors for the report, and to the FCDO for funding this work. The comments that you made, Jenny, Carlen, at the beginning, I mean, really speak to why EdgeEffect even exists as an organisation, which goes back about 10 years ago now. And we saw that there was this massive gap between the operations of the development and humanitarian sectors, how programs are actually designed and implemented and evaluated, and the rights, the needs, and the strengths of LGBTIQ people. And one of the challenges was that there often seemed to be a lack of conversation between the kinds of actors who do humanitarian and development programs and LGBTIQ human rights organisations, whether they operate globally, regionally, nationally, or subnationally. And a lot of government actors, a lot of UN agencies, a lot of INGOs still don't always really understand that LGBTIQ people need to be part of what they're doing, and they don't really understand how to do it. And at the same time, a lot of LGBTIQ CSOs have got all kinds of responsibilities, aren't necessarily development or humanitarian specialists, and so there's a missing conversation. In terms specifically of social protection, we came to this during the COVID-19 pandemic, and early on saw that LGBTIQ people were being affected specifically because often a reliance on, for example, informal economy work meant that they were being impacted very directly by shutdowns. People who often didn't have much in the way of savings, who didn't necessarily have the other kinds of social networks that people can fall back on. And the consequences can be really, really quite dramatic. So we put out a briefing note, which luckily was picked up by Australia's Department of Foreign Affairs and Trade. And I want to say thank you to Felicity O'Brien and DFAT's social protection area, who then commissioned that piece of work. We don't do a lot for them specifically, which is a quote from a donor. I won't say who, but I guess reflects what we found, which is very sort of consistent with this new report. That there isn't a lot of understanding about specifically how to do LGBTIQ inclusive social protection in the various ways that social protection can and need to be done. So we did a review of globally, but also case studies in Bangladesh, Indonesia, and Fiji, and we found Crisis Response Mechanism, which was an organisation already talking about social protection and LGBTIQ people in Indonesia, and they became the country implementer for a program that was designed specifically to address the social protection needs of LGBTIQ people. So I think one of the things that I think it's really important to recognise, as Cody started to mention, is that the impact of the anti-rights, anti-gender, anti-LGBTIQ, anti-trans movements, but also that the consequences of loss of funding in the humanitarian and development sectors over the last 12 months. The program that we co-designed and was being implemented with CRM in Indonesia was stopped because it was Department of State funded through a Global Equality Fund project. But it's not only the US government that's cut back funding for international assistance and LGBTIQ inclusion, and that includes a range of donors in Europe and elsewhere. And there's a lot of LGBTIQ community architecture that's at risk. And without that community architecture, it's then really hard then to go steps further and to start think about designing and implementing things which are more complex, like social protection systems. So, for example, CRM in Indonesia, through another organisation, has a legal aid network, and that legal aid network and its very existence was a really important part of our plans for how to make LGBTIQ people aware of services so that they could get more access from Indonesia's existing social protection system, as well as the work we were doing to try to help design a more inclusive system in the future. So it's really important that funding comes back somehow. And as well as funding research projects like DFAT did with, we don't do a lot for them specifically, and this piece of work funded by the FCDO, that we actually get funding to get into the nuts and bolts of how to design, implement, evaluate LGBTIQ inclusive social protection systems. It is really, really important to get into those nuts and bolts and to be able to have a conversation about, well, what's more important, areas of inclusion or areas of exclusion? How might LGBTIQ organisations operate as intermediaries if that's how these programs need to operate? What can we say about conditionalities and to remove conditionalities? So, for example, compulsory training that might go along with assistance, because those kinds of things might not be safe for LGBTIQ people. So we need the opportunities to explore and design inclusive programs, whether they're mainstreamed or targeted programs. And we need to be able to do this in ways which are contextual. So the work that we co-designed and was being implemented in Indonesia started off with support for LGBTIQ actors and others in Indonesia to understand more about how social protection systems are designed, but also how, in the context of the kinds of narratives about LGBTIQ people in the country, do you come up with a program that people are willing to go along with? Because we can design social protection systems that don't necessarily, or inclusive social protection systems that don't necessarily trigger a lot of feelings about LGBTIQ people, because what we're talking about here is really basic stuff. It's like, do we have money to survive? Do we have somewhere to stay overnight? And sometimes, even in countries and contexts where other aspects of LGBTIQ people's lives are not supported, that we can find ways of finding pockets of support for our very existence. And maybe the last thing I'll just mention is that in the absence of all of that, yes, informal social protection systems, which are often provided by LGBTIQ organisations in the breach, remain critically important. and more work needs to be done to support those in the breach. But they're not the solution by themselves. LGBTIQ organisations need to be at the centre of a lot of the design exercises and implementation where relevant. But other organisations also need to carry the load here. As I mentioned, LGBTIQ organisations have an awful lot going on, and it's up to organisations in the room and those working in the social protection space and many other development and humanitarian spaces to build the organisational capabilities, the networks, understandings of how to manage risk, all of those things so that we can make progress here. But conversations like these are a great start. And I'll leave it there for now.
Thanks so much, Emily, for those reflections. I think it's really true and very important to raise these kind of shortfalls within the international architecture in the current context around funding and the need for investment and support in this area, not only in programming, but also in research, so we have a better understanding of what works and can inform advocacy going forward. So I'd like to kind of transition with that thought into Loui Williams's reflections on LGBT plus social protection, inclusive social protection, and the work that's being done at UN Women at the moment. So over to you, Loui.
Thank you, Louisa. I'm happy to be here. I feel like I'm wearing two hats, both in terms of my role in the research team at UN Women and also with UN Globe, supporting and advocating for LGBTQ personnel across the UN system. So I'm really pleased that you invited me to join in. And thanks, Fabiana, for sharing. I don't actually see the PowerPoint, but I'm just going to carry on anyway. So I'm going to be drawing on a Secretary General's report, which I worked on, which was led by SOGIESC on gender responsive social protection. I can see that someone, Dion, is saying that they can't see the presentation either, Fabiana, so just letting you know. And while this report didn't cover LGBTIQ people that much, I think it has a lot of resonance with the mapping that Cody and Maria have worked on, so I'll be drawing on that. I can see it now, Fabiana, thank you. And next slide, please. So firstly, to go through some of the strengths of this mapping, it's one of the first substantive reviews on this topic, mapping the literature and filling a super important gap. I think we all know that so much of the data we have, qualitative and quantitative, on access to social protection is on a gender binary. For example, in the World Survey report that I just showed, we present global data that worldwide 2 billion women and girls are without access to any form of social protection, compared to 1.8 billion men. And that's very interesting. But, I think a lot of us would really like to go further and understand more from an LGBTIQ perspective. And so I think what this mapping does so well is to bring into the conversation about gender responsive social protection this LGBTIQ perspective, which is so important. We need to break down these false distinctions that frame LGBTIQ people's experiences as somehow outside of this gender responsive space. And I know that we'll go into this a little more in the Q&A, and Emily touched on it too. But I do think a big part of why these two conversations are often seen as separate is because of the challenging global context that we're in, context of backlash that pits these groups against each other, and makes us compete for highly limited resources and also for discursive space. So moving to the third strength I see in this mapping, I appreciate how Cody and Maria have outlined a range of action that is possible, from these low-hanging fruits, whether that's tweaks to existing programs, easy tweaks that can make them more accessible to queer people, such as broadening understandings of household formations that are eligible for certain programs, but also thinking about what those more holistic structural shifts that are needed in order to fully include LGBTIQ people. Which brings me to point 4, the fact that we really need to be thinking about this systems approach. In the World Survey report, we identify that a lot of those more transformative outcomes of social protection are possible where programs are forging clear links with other sectors such as housing, health, and so on. And I think that Cody and Maria have done a great job of identifying examples where they do exist of programs doing that and making those cross-sectoral links. But just as Emily was speaking and sort of talking about her work during COVID, and your paper was indeed the first I read on this topic. But just to point to one program that was in Argentina during COVID, the Acompañar cash transfer program, which was able to make those cross-sectoral linkages and offered an accompaniment model for LGBTIQ people experiencing violence, and it included links with psychological support and also access to housing. Next slide, please, Fabiana. And now to go to what remaining questions are still on my mind after reading the mapping. I think first, thinking about these intersections with emerging topics, and I know that Cody, you also talked about the lack of data on certain intersectionalities in terms of identities under the LGBTIQ umbrella, but also I think bringing this into the current moment, the current context of multiple overlapping crises, and thinking about what are queer people experiencing at this moment. Secondly, I think the mapping raises interesting questions about informal social protection. I think there are pros and cons of recognizing this informal social protection. The pros being that it visibilizes a lot of labor that we know is being carried out, often unpaid, by queer people themselves through mutual aid, etc. But on the flip side, do we then reduce the obligations of the state, particularly in this current context of backlash? And furthermore, do we risk co-opting the work that is being carried out by LGBTIQ people? Which leads me to my third point, which I think would be interesting to explore further, around the working conditions of social protection delivery workers, both formal and informal. And I know the report by Cody and Maria highlights some of the negative sides of this and the violence that queer people can experience through harmful norms and so on in engaging with social protection systems. But I think we could also think of the potential of properly training, properly compensating these workers and ensuring good working conditions and access to social protection themselves for these workers who often lack it in order to create a conducive context for supporting LGBTIQ people. And finally, I know I'm at time, but just to say that something I also noticed as maybe missing from the mapping was this need for more thinking through what accountability and redress means for LGBTIQ people who have experienced violence in accessing social protection. I know I've run over time, so next slide, I'll just show these 2 reports that you can maybe go and look up a little more, which I think from UN Women, which are relevant to this topic. And I'll stop here. Thank you.
Thank you, Loui. Thank you so much for those reflections. We will move on to our Q&A section of the webinar today. So we have about 15-20 minutes for discussion. So please do put your questions in the Q&A chat, or because we are such a small group today, I think we can allow participants to interact with the panel. So I believe you can put your hand up and we can unmute you if you would like to ask a question, or if you have any comments or anything you'd like to discuss with the panel. But I think to kick off the Q&A and the discussion portion, I wanted to ask Cody about some of the examples that were coming out of the mapping. Again, encourage everyone to read the paper because there are several examples of both informal and formal systems providing support to persons with persons of LGBT plus identities. And so I'd love to hear more about some of the concrete steps governments have taken to expand coverage and inclusion of LGBT plus populations. So that's for Cody.
Great. Exciting, because now we get in the weeds of talking about the topic and how to actually mobilize it. So it's from 51 different materials. I'm just going to highlight a few, both from a kind of mainstreaming, integrating approach, but one also standalone, specifically for trans people, a program. So first is from Brazil. They have the Bolsa Familia program. It's a conditional cash transfer initiative to support families. And in 2011, they had a landmark Supreme Court ruling that recognized same-sex couples in stable unions as eligible family units. So that's how they practically redefined the idea of family in the eyes of the state to expand social protection. In the Netherlands, residents must purchase health insurance as part of the National Contributory Social Protection Scheme, and most insurance policies cover transition-related healthcare. And even in the United States, SNAP is a non-contributory voucher program. It defines a household as any group of individuals who purchase and prepare meals together. So a real expansion and broad thinking about what constitutes a family. And finally, just to highlight a standalone program from the government of Punjab in Pakistan. It really stood out how comprehensive their transgender welfare policy is. Now, there's questions about implementation and how this is actually mobilized, but a few things that were listed here that I thought were really innovative were pension schemes, unemployment insurance, hardship grants for females with disabilities, vocational training such as garment stitching programs, conditional cash transfers for skill building, 1 to 5% government job quotas, entrepreneurship support through asset transfers like sewing machines or livestock, and interest-free microloans through NGOs. So just 10 practical ways of how to build that into a policy from a government perspective. But I think that shows, as Loui was mentioning, a systems approach. How do we balance a systems approach, but meet the needs of LGBT people in a very specific way?
Thanks, Cody. I think it's really great to see, governments taking steps, being supportive of inclusion. But I wanted to ask Emily specifically in contexts where the enabling environment is less supportive of inclusion. What do you see are the opportunities to really advance this in those types of less supportive or even hostile environments? And what are some of the key considerations that social protection actors, as well as LGBT plus activists, should bear in mind when designing these programs in these contexts?
Thanks, Louisa. I think those kinds of examples that Cody was giving and the mapping that's done in the report is really important to understand where this is happening anywhere, I'll say. Because I think that there's a lot of things that we can learn from different contexts. Obviously, how to do things in different contexts varies hugely. But I think that the first thing that I sometimes find myself counseling is that we don't have to start in the hardest places. It is actually okay to start to learn how to do LGBTIQ inclusion in social protection in some of the places that are not quite so hard. And sometimes we do get questions thrown at us, which is sort of something along the lines of, what about Yemen? And I'll just say that Yemen's important, LGBTIQ people there are important. It would be great to be able to do things there. But the fact that when we don't have a solution for Yemen right now, or a comprehensive solution for Yemen right now, doesn't mean that we shouldn't be doing things in Lebanon or Fiji or a whole pile of other contexts. I think something that is really important is obviously to work contextually. I mean, and to understand the context of LGBTIQ people and the narratives around LGBTIQ people in different places. So the work that we were doing before it was shut down in Indonesia was based on a bedrock of understanding how LGBTIQ people are understood in Indonesia, because social protection actors in Indonesia don't operate in some kind of weird, space. They operate in Indonesia. They're surrounded by this all the time. I think it's also important, though, to understand that um, uh, all kinds of different contexts are not monolithic. And governments are not monolithic either. So even where you might have a situation where there is an anti-LGBTIQ national political dialogue, that doesn't mean that a Ministry of Social Welfare, or whichever ministry is responsible for different aspects of social protection, it doesn't mean there are individuals in there that are actually quite willing to help move things along. And so part of the challenge is to find those individuals, and sometimes to frame this work in ways that means that they can be allies, that they can push things forward in their own way, in their own language. And so while it it can often be really valuable to connect what's going on in social protection to LGBTIQ human rights concerns, for example, about recognition of partnerships, about access to identity cards and things like that. Sometimes we need to better calibrate our language and just sort of take the small wins, if you like, and start building something. I think it is possible to work in more difficult contexts in ways that are successful, that won't trigger as much resistance or backlash. It also requires investment, and none of this. I mean, whereas a community, LGBTIQ people and organizations do all kinds of things for free, but I will, without wanting to be a broken record, I will keep coming back to the resourcing of this that really does need to happen somehow. Thanks.
Thanks, Emily. And don't worry about being a broken record. I think we have to keep saying this and saying this and saying this in order for people to really pick up the message and understand what it is. So I think broken records in this type of discussion is great and really important to raise those issues. And I agree. I think that starting either in kind of a less hostile environment, uh, getting some of those lessons learned, getting some of those research pieces to inform advocacy, and then applying that to kind of less friendly environments, especially where we can identify champions, can help to move this. I don't think it's, a 1 to 100 type of situation. We do have to move this gradually, like we've seen with other movements. So I think I think your points are really resonating with the context. So I do want to maybe talk a little bit more about the point of how we can bring the two pieces of work together. So you talked about this a little bit in terms of social protection and LGBT human rights, but this is for Loui and Emily in terms of how we can bring the two together a little bit more, how we can have them speaking together, because right now I think we're a bit siloed in a lot of our discussions, and there's a lack of understanding between the two sectors on how we can work together a bit more. So maybe I can ask Loui to come in to talk about, from the social protections perspective, about how social protection actors can engage more in this space. And then I'll go to Emily about LGBT activists and how they can take this forward. Over to you, Loui.
Thanks, Louisa. Yeah, I mean, just to build on what I was talking about in the presentation, I think the current context of backlash is a huge part of why these conversations continue to be separate. I think, especially when we think about funding, people are really reluctant to cede space that they currently have because they're worried about losing what they do have. and putting existing resources at risk. So I think we see, ongoing trans exclusivity in the framing of programs. We just don't see an incentive to bring LGBTIQ populations into the design and implementation of programs. And that's a false narrative. I think, we all know that these that fighting for rights of both groups are one and the same, and it can only bring greater inclusivity to bring them together. But I think just specifically to respond to your question about what social protection practitioners can do, I think that part of the issue is honestly that we just don't speak the same language. Um, I think social protection is so full of jargon, that often that can be a barrier in itself to just getting on the same page. I think a lot of LGBTIQ organizations aren't thinking about contributory, non-contributory. They don't even know what social protection means. It's not like a intuitive, oh, that's talking about the welfare state, or oh, that's talking about cash transfers, etc. My perception is that that is a big initial barrier to overcome to just so we can talk about the same things, because queer people, are talking about wanting food, wanting shelter, not wanting to be poor, but the language that they use might be different. And so I think it's important for social protection people to get on board with that and to use language that is accessible. Um, And, on the flip side, there is a lot of terminology to get to grips with in the LGBTIQ space as well. But I think that's slightly different. It's about identity, um, and it's social protection workers' responsibility to educate themselves and get on board with that, in order to be able to fully engage and fully respond to the needs of different groups. Um, and just one final point on this, I think there is, of course, a lack of data that Cody and Maria have identified, but too often that's used as an excuse for lack of action. And we know enough already that there's a lot that we know. There's a lot that we can draw from um, parallel uh, topics such as humanitarian, other crises that are going on, a lot of the needs of LGBTIQ people that may have been mapped in those contexts, those are learning lessons that we can use in social protection space. So I think we just need to be creative, and LGBTIQ people will tell us what they need. So we just need to listen, really.
Thanks, Loui. Emily, your perspectives on how the LGBT plus organizations and activists can work more closely with social protection actors, building on what Loui was saying in terms of the need for common language, common, less jargon, the sharing of more data and needs assessments on what people with diverse sexual orientations, gender expressions, and identities need in different situations.
Yeah, I think it is very much a two-way street. And even before funding cuts, I mean, we often struggled to work with different donors and UN agencies and NGOs to actually get them to move beyond a tokenistic engagement with LGBTIQ people to actually understand lived experience, but even to go beyond understanding lived experience of different LGBTIQ people, to be thinking about a social norms-based approach. And that's something that we've just been talking with DPAD a lot about in the last few months, as we've been supporting some work there on mainstreaming LGBTIQ inclusion. That in the countries that we're working in, and within the design of humanitarian and development programs, what we see is assumptions that everyone's heterosexual or should be heterosexual, assumptions that everyone's cisgendered or should be, or assumptions that everyone lives in the gender binary or that everyone's sex characteristics are binary. And something that we need to be able to do is to have an analytical framework. So in the same way as with, if you there's a parallel process here with inclusion of people with disabilities, where we move from pathologization to charity to a social model. There's a similar shift that needs to happen in the LGBTIQ space, where we move from pathologization away from charity and sympathy, and to have an analytical framework that then allows us to do the kinds of design work that we need to do. Where LGBTIQ civil society fits into this, I think in a variety of ways. I think uh, as Louis mentioned, LGBTIQ organisations are kind of doing this anyway, even if they call it different things. But when we were working with CRM, I mean, that's for smart people, they got it. It just took a little bit of effort in order so we brought in a social protection specialist to design training materials in Bahasa, Indonesia, that spoke to Indonesia's social protection architecture, and then everyone got around the table and we worked it out. It's sometimes I think we make this too hard, and LGBTIQ inclusion sort of becomes this sort of, oh, well, how do we do that? It's like, well, that's different, and well, these people are different, aren't they? It's like we've got tools. If there's risk, use our risk mitigation tools. If we need to do assessments, we use our assessment tools. If we need to engage with communities, we use our community engagement tools. And sometimes we really do make this, I think, harder and weirder than it needs to be. LGBTIQ organisations can't do all the work. They do a lot of work for nothing in a context of reduced funding anyway. Community engagement is where often they're really strong, even if they don't have a history or background in sort of the technical design of humanitarian and development programs. But if we actually just get around the table and have the conversations that we need to have, we can actually move things. And so that would be my final sort of, I guess, thought here is that we can do this. We actually can do this. And sometimes I think we need to stop talking about it. As we said, no, we will never have enough data. But that's okay. We'll just one of the things we're also talking about with DFAT in the last few weeks is like, okay, well, if you don't have enough secondary data to do analysis, just assume that LGBTIQ people are facing issues and will face barriers in accessing programs. Just assume it, and you're almost certainly going to be correct. And let's just move. So we can actually just move forward, please.
I think that's a really we're about at time. So before I ask Loui and Cody to also give any final reflections from their side, I agree with Emily that we do have quite a lot of tools that can be adapted for this. And I think we can assume that there's at least barriers in terms of access to social protection, particularly in stigma and attitudes with people who are administering and providing the services. And that at the very least, we should be addressing to ensure that they can access mainstream programs. And then once we have that, we can probably start working on some targeted programs as well. So just in the last 2 minutes before we close, Loui or Cody, do you have any final reflections that you want to share, or any final thoughts before we end?
Thanks, Louisa. Nothing particular, but just to say that if anyone would like to get in touch to talk about anything more, please do. I'm really interested in this topic. I'll put my email in the chat. And big thanks to everybody.
Yeah, also just ending on a very positive, uplifting cross-movement note of just sharing a personal experience, because I have my researcher hat on, of I mostly have done work on LGBT youth and education. And before this project, I hadn't heard what social protection is. So I think there's a lot of possibility of what this could offer. I'm like, this is a very innovative framework and framing in this time. And it's kind of like once I knew it, I got it, and we could like go forward together and like cross movement building. So I think that's a commitment for me to continue to engage with social protection actors. And I hope that commitment is, on the cross movement space, that we continue to go together.
Yes, hopefully this is just the start of the conversation and not the end of the conversation. And we do have a lot more work ahead of us, but this was a great, I think, first step and a step in the right direction, and bringing together the two groups where we probably don't have a lot of understanding of each other at this moment, can only help build strong programming and systems going forward. So I just want to thank Cody, Louie, and Emily for their participation and presenting during today's webinar. And thank you to the attendees who took time to participate as well. Again, the PowerPoints and the recordings will be shared with you through email. And we do hope that you read the papers. And we do hope that we continue this conversation going forward, and we can build a more inclusive social protection system for LGBT plus individuals. So thank you, everybody, and have a good rest of your day.